Hello, Tara here from Aging Your Way. Today I'm going to talk about home care, a service that most people think they will never need, but when they do, they are very happy it exists. Did you know that people, including healthcare providers, use the term home care to mean a variety of different things? It's no wonder the average person gets confused about what home care actually is, who needs it, and most importantly, who pays for it. After working in home health care for 20 years as a medical professional, I've discovered there's a lot of misinformation out there regarding care provided in the home. In this video and my next one, I will share accurate, reliable information with you so that you will understand what home care is, the situations where you actually need it, and who is expected to pay for it. In an attempt to help you make sense of home care, I'm going to share information about medical home health care in this video, and I will address non-medical home care in my next video. I will also share little-known tips in this video for how you can tell if the home health care agency and their staff are doing what they should be and delivering excellent care to you every time they come to your home. Over the course of my career, I've worked in hospitals, outpatient clinics, and home health care. The reason I chose to spend most of my career in home health care is that I saw firsthand the amazing benefits of healing and recovering from a health issue in your own home. Trust me, it's much more desirable than recovering in a hospital or a facility. If your healthcare provider recommends home health care to you at some point in the future, I hope that you agree to have it. Allowing nurses, therapists, and other healthcare professionals to come into your home and provide necessary care is not only more convenient for you, but it can also have a positive impact on the quality of your life. With that said, it's important that you know what you can expect from a home healthcare agency and how to tell if your agency and their staff are doing everything they should be. Here are the key components of home health care that are important for you to know. Medical home health care is referred to as certified home care, as in Medicare certified, or skilled home care, or even home health. The purpose of home health care is to provide short-term medical care in your home, usually with the goal of improving your health and function. The most common conditions people receive home health care for is recovery after surgery or serious injury, management of a chronic disease like diabetes or heart failure, or physical decline for any reason that has resulted in a loss of safe and independent functioning in your home. Some or all of the costs of home health care are usually covered by medical insurance plans, including traditional Medicare. But it is important that you check your individual insurance plan for coverage details because many insurance companies limit the number of home health care visits they will cover, and some insurance plans require the home health agency charge you a copay or other out-of-pocket cost per visit, so please check your plan. Home health care agencies must provide the following services in your home per the insurance companies, including Medicare. Skilled nursing, also referred to as SN, physical therapy, referred to as PT, occupational therapy, referred to as OT, speech therapy, referred to as ST, social work services, also called MSW services, and home health aid services for personal care. Please note, you should only receive the services that you need and want. Most people only need 2 or 3 of these services at a time. Other requirements for home health care are that it must be ordered by a physician, which includes an MD, a DO, or a DPM, which is really a podiatrist. Some insurance plans also will allow a physician assistant or a nurse practitioner to order and oversee home health care services. Home health care is typically ordered by your primary care provider, but can be ordered by a specialist physician or a physician from a hospital or rehab center that you have been in recently. Also, Home health care is only covered for people who are considered homebound per most insurance plan requirements. While there are a few exceptions, homebound typically means that the home is the safest and best place for the person to receive the health care they need. This is usually because of a medical diagnosis, poor endurance, and or the need for assistance of others to safely exit the home. Homebound individuals are allowed to leave their home for things like doctor's appointments, religious services, or other infrequent outings. Please note that homebound does not mean bedbound. Per the insurance company requirements, home health care is delivered in a short-term visit model, not a long-term hourly model. A home health care visit is typically 30 to 90 minutes long, depending on what your medical needs are. And depending on the reason that you're receiving home health care, the agency staff will typically come and see you a few times a week for anywhere from 2 to 8 weeks. Many medical insurance plans do not pay for a certified home care agency to provide hourly care, housekeeping, or transportation. So please do not expect that your home health care nurse or therapist will be able to stay several hours at a time to help around the house. The final component I'm going to discuss today is that all home health care agencies must follow rigorous requirements set by CMS to maintain a certified status. Maintaining a certified status is necessary for the agency to bill most insurance plans. It is important for you to know that CMS has many strict requirements in place for certified home health care agencies, and the intention is to ensure that you receive excellent care in your home. CMS holds these home health care agencies accountable for keeping you out of the hospital and improving your health status. So, how can you tell if the home care agency is delivering excellent care or just mediocre care? Most importantly, an agency that's providing excellent care will ensure that you and your loved ones feel like you're well cared for, respected, and that you're making progress over the time the agency staff is providing care for you. In addition, if the home health agency and their staff are delivering excellent care, they should always do the following. State clearly in all print materials and on their website that they are Medicare certified. This is important even if you don't have Medicare, as it symbolizes the agency meets Medicare's strict standards of care. The agency staff should also give you a booklet or folder of information the first time they come to your home, which includes the following important information: the name of the agency and their phone number, with instructions for you to call that number 24 hours a day, 7 days a week, if you need a nurse. Please know that all certified home health agencies are required to have a nurse available to answer your questions and help address your concerns 24 hours a day. The booklet or folder should also contain your rights as a patient or client of the agency, copies of all forms you're asked to sign, and basic instructions for what to do if your symptoms worsen, such as when to call the agency and when to go to the emergency department. A home health care agency delivering excellent care should also be ranked at least 4 out of 5 stars by CMS. CMS publicly lists the quality and customer service ratings for all home care agencies on the Home Health Compare website located at this link up on the screen. I will put this link in the description. This rating is important because CMS determines it by requiring home health care agencies submit outcome data on all of their patients in key areas such as getting around the house, managing medications, and doing daily activities with minimal assistance. CMS requires that agencies work with an independent third party to send customer satisfaction surveys to all of their patients as well. Those results serve as the customer service star rating, so please fill that survey out when you receive one. Attaining a 5-star rating in both areas is very challenging for a home health agency, but attaining at least a 4-star rating is doable for an agency that focuses on the most important things that will help you improve. An excellent home health care agency should also tell you in advance when they are coming to your home for a visit, and they should notify you if they need to change a scheduled appointment.
The only exception to providing advance notice for appointments is if you or your physician ask the agency staff to make an unplanned visit that same day to address a medical issue that you are having. An agency providing excellent care will also ensure that each discipline, nurse or therapist, develops a treatment plan with your input and involvement focused on your goals. Home health staff should also discuss your progress with you weekly and discuss what they recommend as you progress. And the agency staff should coordinate your care by communicating regularly with your physician and with each other. They should always let you know when they have communicated with other healthcare providers about your care. Please know that all the home health staff seeing you are required to communicate regularly with each other about your care, and they should know when each other is scheduled to see you. It's also important that the agency staff follow all CMS home health regulations, even if you don't have Medicare or Medicaid. And they should ensure that all staff who visit you in your home wear an official picture ID badge with the staff person's name and photo, as well as the name of the agency. If someone ever comes to your home without a picture ID badge, feel free to turn them away. Staff wearing picture ID badges is now a minimum standard in all areas of healthcare to keep you safe. Finally, a home health care agency should notify you in writing at least 2 days in advance when they plan to discharge you from their care. Home health care agency staff are required to perform discharge planning with you throughout the entire time they see you. Unless your physician unexpectedly discharges your home care services, you should know well in advance when the agency plans to discharge your services.
One last recommendation regarding home health care that actually applies to all areas of healthcare. Many people aren't aware that CMS has a very important requirement in place for all healthcare providers. They must offer patient choice when recommending a service to you and honor your decision. This means that you always have the right to choose who your healthcare provider is, whether that's a physician, a hospital, or a home health care agency. If you request a home health care agency that your physician or the hospital didn't offer to you, the only acceptable response to your request from them would be, sure, we'll coordinate with that home health agency, we'll make sure they contract with your insurance and set up your services. CMS is very clear in the regulations for all healthcare providers that you should not be coerced to accept a different agency just because the physician or hospital happen to work with that agency more often. I know that I've shared a lot of information today, but know that this is just a brief summary of home health care. If you would like more detailed information and helpful tips about home health care, please read my latest blog post at agingyourway.net under the blog tab. And if you would like some guidance with determining if you or a loved one would benefit from home health services, or you are ready to make an aging plan, feel free to click on the Services tab at agingyourway.net to learn more about our Aging Advisor services. The initial 30-minute consultation is always free. Thank you so much for your time. Feel free to leave a comment below if there are other topics like this you would like me to address, and don't forget to like and subscribe below as well.